are, like me, very excited about the idea that we can make this process of finding kids permanent families across state lines easier and cheaper and more effective and more timely. And I am welcoming today Marcy Roth and Nicole Dobbins to do our presentation. Let me tell you a little bit about our presenters because they are some pretty fabulous women. So Marcy is the project director for the NEICE pilot, and this is a pilot of the American Public Human Services Association. She is also a partner at the True North Group, and her portfolio includes adolescent health and child welfare policy projects. Marcy also provides policy support to the Commission on Child Abuse and Neglect Fatalities and was the Senior Director of Policy and Communications at Child Trends. There she was directing communications, research, and policy projects, and she also supported the FosteringConnections.org project. She was writing briefs, developing webinars, and assisting with management of the website. Prior to that, Marcy was a program officer at the Pew Charitable Trusts, and we all know them. They do great work. Our other presenter is Nicole Dobbins, who is the Executive Director for Voice for Adoption. That is a Washington, D.C. based national advocacy organization, and the mission is to speak in one single voice with policymakers representing the interests of foster children who are awaiting adoption and the families who adopt them. Previously, she served as Director of Events for Foster Club, which is the national network for young people in foster care, and there she was responsible for engaging foster care alumni leaders to train 2,500 foster youth annually from all across the country. She now is serving as President of the Foster Club's Board of Directors. Nicole has testified on 2 separate occasions in front of the United States Congressional House of Representatives for the Committee on Ways and Means, once as a young leader sharing her own personal story about aging out of care, and once in her current professional capacity. Nicole served as spokesperson for the National Foster Care Month campaign and was recognized in 2008 as one of 10 outstanding young leaders by the Kids Are Waiting campaign, which was a project of Pew Charitable Trust. As an alumni of Oregon's foster care system, Nicole leverages her firsthand experience and passion to effectively advocate on behalf of young people currently living in out-of-home care. She graduated from Oregon State University and is an active alumni member of her sorority where she volunteers in her local community, and I can tell you she was just part of a fundraiser for that sorority, and I was very proud to contribute. I'm sure that Nicole will be happy to let you know how you contribute more. Well, so we clearly have some great presenters today. It's going to be a fabulous presentation. I first want to tell you just a little bit about how our webinars work, and so if Marcy can go to the next slide, I'll give you a little primer, and we will begin.
I'm trying.
Okay, no problem.
Oops, okay.
So, Marcy, just so you know, I have the similar problem. If my clicker is on the mute area, I can't go forward. So you need to make your little clicker arrow go over to the left-hand side, and it works better.
Okay, great.
So, folks, you can see the slides on your computer. You won't be able to make them go forward, but Marcy will. In order to hear, you can either go through your computer speakers or you can switch and use telephone. I would suggest that you do whichever is working best for you in terms of audio quality. All of you will be muted through the presentation, but as you can see down at the bottom, there is a question box, and you can click on there and send any kind of a question to us at any time. I will be keeping track of those questions, and at times during the presentation or at the end of the presentation, according to Marcy and Nicole's prompts, we will stop and take questions. And I also know, Marcy and Nicole, that we have gotten some questions in advance by folks through email because they were already excited about what they were going to learn. So I guess that's all I need to tell you all, and I'm going to mute myself unless there's a point in time when you ask us for questions, at which time I will come back.
Great.
Thank you, Marcy and Nicole.
Oh, thank you so much for that introduction. That was so lovely. So hello, everyone. This is Marcy Roth, and Nicole is on the line with me as well. And we are both so happy that you could tune in. And I know there are lots of webinars out there, and you guys are all very busy. So it's nice of you to fit us into your day. We just want to tell you a little bit about the NEICE project. You've heard a kind of a teaser already. But I wanted to start with the ICPC process because I think it's kind of this mysterious way that we're able to place kids across state lines, and it's complicated and it's time-consuming, and someone called it the four-letter word of the child welfare system. So we're trying to change that. But let me tell you a little bit about the way the process is supposed to work. So it starts out with a caseworker who has a child who's in crisis, who needs a placement. And they research possible placements and realize that grandma lives across the state line. Let's say we're going between Pennsylvania and New York. Grandma lives in New York, and she's very happy to take the child right away, whatever she can do. And so the caseworker starts the ICPC process. He or she completes this placement packet that's required, and they submit it to the central ICPC office in their state. So that's in the state of Pennsylvania in this example. The central office in Pennsylvania for the ICPC checks the packet, makes sure all the forms and everything's in the right order and everything's filled out to the letter, and they send that packet to New York, the receiving state, to the central ICPC office. Same thing. They review the materials, make sure it's all in order, and then they send it down to the social services agency at the local level to do the home study to make sure that this placement is a safe one for the child. The local office does that home study, sends the placement decision back to their New York central office, and then the central office in New York sends the decision, whether it was approved or not, back to the originating state. The sending state in this case was Pennsylvania. So that's kind of the process, and it's governed by something called the Interstate Compact on the Placement of Children, which is really an agreement among the 52 states, the 50 states plus DC and the U.S. Virgin Islands. And they've all signed on to this process of how they're going to handle these placements. The challenge, of course, is that this compact was designed 50 years ago, back in the time when everything was done by paper. So the current way and the current length of time it takes for placing a children across state lines is about 50 to 87 days. And this varies greatly, and usually is much longer than that. Sometimes states report that it's even 6 months or even a year, even when we have grandmother willing to take the child. Sometimes the paperwork that it takes to get that child there just takes that long, because the caseworker, in this case right now, currently most of the states have paper files. So they make all that packet of information that has the home study and all the information, medical, all the things that they have about the child. They make triple copies of it, 3 copies of it, put it in the mail, snail mail or FedEx, and then they send that off. And so the process, as you can imagine, is just awful. It takes a long time. And then it gets to a caseworker's desk. You can see one of our people who's now involved with the NEICE pilot. That was her desk before the NEICE system. You can see the paper is kind of just flowing everywhere. So very paper intensive and labor intensive as well. So NEICE was basically designed and thought of as a way to let's take the ICPC system into the 21st century and use computers and the internet and the web to make this process a lot faster. So some of our project goals include the ones you see here. We want to increase the administrative efficiency of the ICPC process. We want to, ultimately improve service delivery for children and families. We don't want them to spend one day longer than they have to, not with a family that can care for them. And we really want to reduce barriers for children to access interstate placement and to encourage, I guess the corollary of that is to encourage caseworkers to use the ICPC process more, to not see it as this terrible, burdensome, takes forever process, but something that they can use really expediently to make sure a child gets placed where they need to be. So those are our project goals. We have several partners to the NEICE project. We're very fortunate to have received a grant from a cooperative agreement from the Children's Bureau here. So at APHSA, we received this cooperative agreement to build the NEICE system and to pilot it. It was a award that came from the Office of Management and Budget from their Innovation Award. Basically, APHSA did a presentation along with their partner, the Association of the Administrators of the Interstate Compact on the Placement of Children. That's a mouthful. It took me a long time to learn that acronym. The APHSA and AAICPC went to the OMB and said, hey, we have this idea. We think we could really transform the way the ICPC works just by building an electronic system. And the OMB said, okay, that sounds like a good idea. Let's try to do that. So that's sort of where the NEICE project originated. In addition to those partners, we have Tetris Corporation, which is our technical partner. They're the ones who helped build the NEICE and are maintaining it. We were required by the cooperative agreement to have a robust evaluation, and that's WRMA, who's conducting that for us. And then the state of Florida is also a key partner to us in this project. And as some of you may know, Florida actually designed the first electronic system to handle the ICPC cases there in Florida. They were tired of the delays and complaints, and they just said, okay, what can we do to change this? And it's really because of their leadership and vision that we're kind of where we are today with the NEICE project. So here's our timeline of where we've come. NEICE is a 17-month pilot, and we actually have an extension to go 3 extra months. So we're scheduled to end in May of this year. And this is sort of the timeline of how we came together. We have 6 states that are part of the NEICE system: Indiana, Florida, Nevada, South Carolina, Wisconsin, and DC. And if you guys are from those states or know anyone who works in those states, they should really get some kudos and congratulations and thanks, because they have worked very hard to help us build and launch the system. And we basically started developing and designing NEICE in February of last year. So that's when all the partners kind of came together for the first time. And by August, the system was built and launched, and we were entering cases and children's information into the system. So it was a very short timeline. I have to admit, when I first came on this project as project director and they said, can you do this in 17 months? I was like, well, we can try. But we did it, and it was a lot of hard work from all those partners that I mentioned before. And we've been in operation since then. So the evaluation report is scheduled to be released in May. So here are some of the features of NEICE that the caseworkers and the states get really excited about. They're able to import child welfare data, their information on an individual child, directly from their SACWA system, so that they don't have to re-enter a lot of the data. So that's a real plus. They're able to scan and upload documents that can be attached to the case. And then they can create and transmit these forms that are required for the ICPC process, called the 100A and 100Bs, electronically with the push of a button. And then I won't go through all these features, but there's a lot of advantages to this that people are excited about. And probably one of the key things is that there's finally, like a flashlight is shining, as I said to someone yesterday. A flashlight is shining on the ICPC process, and at least with these 6 states, we have some insights into where cases are. You can track to see, okay, this case was sent on this date, and this receiving state has looked at it, and they have an idea of what they want to do with it next, and where it's going next. It's just a much more transparent process than we've ever been able to do before. So we're really excited about it. There's one other key feature that I don't really have on here. I guess it's the last point. This uses modern IT platforms. NEICE is one of the first human services systems in the country to use something called the NEIM standards, and that's a technical thing. It basically is the National Information Exchange Model Standards, and it basically gives people a roadmap for how to structure their data so that different systems, IT systems, can talk to each other using standardized data. And this sounds kind of like a duh thing, but it's really sort of innovative, because most IT systems that were built over the last 30 years just use whatever data system they wanted to just to create and to build their fields. And the result is that you have 50, 60, 100, 1,000 different data systems out there with information that can't talk to each other. So NEICE is really allowing a state child welfare data system in Indiana to be able to push a button and transmit their information directly into Florida system, and that's a pretty big innovation that we're excited about. So here's the real thing, the most important thing that we're excited about, and that's some of this, the numbers from NEICE. And right now we're averaging about 160 to 175 cases a week. So we have over 4,500 cases as of last week. There's 6,150 home studies that have been processed, and over 5,500 children who've been entered into the system and are being considered for placement. So we're really excited to have that high of numbers. We didn't know how many children we would even have in this pilot, and it's great also because we can see, if you look at where the home studies are there, you can see kind of where they are in the process, that of those 6,000, we've already, the workers have already approved 1,900 of them and said, yes, those placements are fine. And 1,100 of them were denied. And even though it's a denial, at least there's an answer, and a caseworker is not waiting forever to know that, okay, no, that placement's not going to work, so they can start pursuing other options. So, you know, over half, basically, of the home studies, we have an answer already, and we just haven't been in operation that long. So it's a really great improvement over where we were. Okay. So I know I'm giving a lot of information, a lot of numbers at you, but I want to share some of the preliminary findings about time savings. And I won't go through each one of these bullets, but basically we're finding that our baseline data from before the states started using the NEICE, the pilot states, was it took them about 73 days to process a case on average. And that's including foster care as well as private adoptions. And now it's down to 36 days. So that's just a really significant improvement, and it just means a lot for the children who are waiting to be placed in a permanent placement. So we're very proud of that. In addition to the time savings and what this means for kids and families, it's also a cost savings for the states that are using it, because they don't have the mailing and copying costs that they've had. So the evaluators have calculated that the average cost of copying and mailing a case is $25. And we think there are about 65,000 children who are involved in an ICPC placement each year. We don't know the exact number because there's no data system yet, but the estimates are it's around 65,000. So if you take those two together, the potential costs just for mailing and copying alone are over 1.6 million nationally. So this is really a huge saving. And Florida, as I mentioned, had implemented this project. They created the original electronic system. They saved several $100,000 just in mailing costs alone. And what I would also just add is that does not include staff time or any potential savings from placement costs that a state would be incurring if a child was waiting in care and could be placed. So we think the potential for savings is significant and should be of interest to states. Okay, so that leads us to sustainability and what our next steps are. So as I mentioned, we're scheduled to end the NEICE system at the end of May, so that's coming up on us very quickly. We've been working really hard to try to find funding so that we can try to extend the system nationally. We don't have any news on that yet, but we hope we will have we will be able to sort that out very soon. We have someone who might be interested, so we are pursuing that very with all of our efforts right now. And what we're doing in the meantime is we're continuing to disseminate information about NEICE through various communication channels, because you know there's that saying, if you build it, they will come. Well, they will come, but they may need some encouragement. So we're looking to create excitement about NEICE and to let advocates know about it, because if a state, you know, Indiana has it, for example, but perhaps Illinois would like it, and if advocates in Illinois would start saying, hey, why aren't we using the NEICE, that's another way of encouraging the state to get on board. So trying to let as many people know as we can. Again, we're trying to make sure that the states and the stakeholders know what the technology is going to let them do, and doing a lot of outreach to the states and to their IT folks and their CEOs to explain some of the benefits of using NEICE. And our ultimate goal is really just to expand the system nationwide. And we actually have a plan on paper of how we could do that in 3 years. So the missing ingredient still is the funding. So that's kind of where we are. And Nicole, is this you, I think?
Yes.
Okay, great. So I'm going to stop talking and turn things over to Nicole. And I just want to thank Nicole also. She's been a tremendous advocate for NEICE and a good friend and colleague in all ways. So, Nicole.
Well, thank you, Marcy. And so I know that Kim shared a little bit about Voice for Adoption, but let me expand a little bit and share why I've been interested in this project and what my role has been as a pseudo partner. I'm not actually a technical partner, but as an advocate, I feel I'm a partner in bringing the attention to pilot projects such as NEICE that have done good works, proven to be successful in measures both by decreasing the number of days or time that a child spends in foster care, and also saving money. So a lot of what we do is advocacy around an agenda, particularly to increase permanency of the 102,000 children who are waiting to be adopted in public foster care, and then promote things around post-permanency services, etc. But when I learned about the project, and I just got excited about the goals of the project, the timeline, what they had achieved in such a short period of time, and I knew it was something that we had to begin talking about, because we all know that foster care is supposed to be a safe haven, but a temporary place, and so that the more we can do to explore how to improve our nation's system, and make sure that it is temporary, the better we're going to do at improving our system as a whole. And so if we can do that and save money, policymakers really like that. And so I believe NEICE accomplishes both. And so my role really has been in bringing congressional attention to what the pilot project has achieved to date. And so back on February 3rd of this year, we hosted a congressional briefing on child welfare and data interoperability. And so we brought all of the partners together to let policymakers know about this innovation fund, who funded it, what states were involved, what it was achieving to date, and the trajectory of the project going forward. Obviously with the goal in mind to share information where we had it, but also to share the fact that we're looking for additional funding, whether it be from private funders or in the event that Congress wanted to put some money toward a project like this from the federal government. And so we invited congressional staff, and I think we had about 50 in attendance. And we focused on key committees of jurisdiction. So the Senate Finance Committee handles child welfare issues, and then in the House of Representatives, we focused on the Ways and Means Committee, particularly the Human Resources Subcommittee. And so our guest speakers were the partners involved, which was Do-Young Chain, who's the Associate Commissioner at the Children's Bureau, Anita Light, who's the Executive Director of the American Public Human Services Association, Michael Peterson, who's the President of the Administrators for the ICPC, the long title that Marcy mentioned earlier, Catherine Ogden, who's the Deputy Compact Administrator of Indiana, who was actually one of the pilot states, and Courtney Lee from the state of Florida, who you heard Marcy mention earlier was one of the really how the pilot got started was modeling after what Florida did in their state. And then Sherrod Rao, who was, or is, excuse me, the president of the Tetris Corporation, who's actually building out the system. And then my role in the briefing was just bringing everyone together and giving some short remarks about, you know, what we see this project doing and how Congress could potentially be involved. And so, as you can see on the screen here, we had a goal to help bring attention to the fact that this pilot does need and will serve children better if we expand this nationwide. And so part of my role as an advocate was to explain to Congress the potential for that and show Congress where innovation in child welfare is working well. And as I mentioned earlier, something policymakers love to hear, saving money. And then explaining why we needed to seek funding, a funding designation to build out the system, right? Because we needed some, and we still do and are looking for, initial dollars to put forward to build out the rest of the capacity of the system so that these other states that are beyond our 6 or 7 that are currently involved can begin operating under this innovative system. And then lastly, really to encourage stakeholders to share the successful results of what Marcy just shared with us, because we're hoping that all of you will hear this webinar and take this information back to your states, back to your back to state administrators, and talk about what this project is doing, the impact of the pilot, and what it can mean if we do get to expand it, because as Marcy said, there will be some need for encouraging states to adopt this, because no one really likes when things change. People, I think, get stuck in their ways, but we can definitely prove to a lot of people about why this is needed and how it can really benefit children in our child welfare system. So again, as an advocate, I think on the Hill, we often are talking about what's not working, and the congressional briefing and bringing this to policymakers and their staff really gave us an opportunity to show the potential of the project and focus on innovation that's already going on, and really talk about where states are making some critical impacts to improvements, because as Marcy mentioned, these states really should be applauded because they put forward an effort in just joining on this pilot to begin with. So I saw the potential and focused on the need for helping raise the visibility of what had already happened. But my goal really is to get this funded in some way. And so from the briefing, we've been in conversation about whether there's possibility to have legislation introduced. And it seems like there is some interest from members of Congress who sit on key committees that are interested in the pilot, interested in what this means for improving the child welfare system. And I'll, again, just focus on cost savings and staff time savings there as well. And so we don't have, the developments of that yet, but we understand that that's in the works. The other thing I think that was brought up at the briefing and maybe not mentioned yet here is the potential for future system impact and the use of the NEICE standards that can translate this data and potentially impact future data sharing across systems. So if you think of children who are in child welfare and also in juvenile justice, or on Medicaid or on TANF, and how those systems currently don't talk with each other, I think there is opportunity to think about maybe much further down the road how this system has been innovative specifically within the ICPC process, but how it could potentially have a greater impact to focus on really tough issues that I think states are grappling with right now, such as child sex trafficking, things that you've heard in the news around adoption, rehoming, and as I already mentioned, children who cross over from child welfare and juvenile justice. So with that being said, I had a really small part in this project and this webinar, but I wanted to make sure to join and just share in terms of an advocate's perspective what I'm doing, but also what all of you can do as advocates in sharing the outcomes of this project and what it can mean if we can find the ability to expand this nationwide. And I hope that we will. So with that, I think we should turn it over to Marcy or the webinar host to find out if there are any questions that we can answer.
Thanks, Nicole. Kim, are you there? I'm not sure how the questions. Oh, hello?
Hello.
Hey.
Can you hear me now?
Yep.
Hello?
We can
Okay,
hear you,
good. You can hear me now. Super. I'm sorry. I was trying to unmute myself and managed to mute myself instead. So we send out these invitations to lots and lots of different folks, including a number of parent connections that we have in the community. And I have a series of questions that I believe did come from a parent. And I sense that NEICE may not be the answer to her questions, but I also am certain that the two of you can answer these questions for both her and for others who are on the line. So I'm going to ask them if that's okay.
We'll do our best.
All right, so there's 5, and they're kind of all connected. So I'm going to ask them all together, and then I can repeat them one at a time if that's easier. So the 5 questions are: what is the time frame for a child to be placed with you from out of state? Will there be any financial support given to you for supporting the child? Are you as the caregiver required to go to get the child in that other state, or is the child brought to you? Once a child is placed with you, is DSS still involved? And I think the broader question is how many different DSS systems will be involved? And finally, will there be any special services provided once the child is with you if they are needed? And again, the expanded question is, what state would be providing those services? So as I said, not really about what NEICE is doing, but certainly about Interstate Compact and the impact on families.
Yeah, okay. Those are great questions, and I'll do my best. I don't have all the technical answers because I really am more focused on NEICE and the kind of technical aspects of implementing that. So I'll do my best. But the time frame really varies. You know, you can see from the ICPC process, there's a bunch of different steps that the placement has to go through. So it really depends on a number of variables. So how quickly the state the DSS in your state can do the home study with you and make sure that their placement is appropriate, and get that answer back to the sending state, the state from which the child is coming. So it can vary. The shortest time frame I've heard is maybe 48 hours to a week, and then longer time frames when the case is more complicated, it can be 6 months to a year. Again, for the financial support, again, it depends on the child and whether they were eligible for financial support in the state in which they are currently living. So it really is a case by case, and there's a whole determination process that the caseworkers go through in the state that the child is in to see if the child is eligible for financial support. And I don't know, Nicole, if you want to add anything to that.
I think I would just recommend that we send out a link, or if this parent is on the line and wants to Google it herself, she can type in ICPC FAQ, and there are a list of 12 questions. The majority of your questions will be answered on that site. That's actually the Association of Administrators of the ICPC. The only question I think that wasn't answered was in terms of which state pays for what, and I believe it's the placing state that pays rather than the receiving state, but don't quote me on that, but that's what I think it is. And all of the other questions, such as once the placement is approved, how long does it take to move the child? If the placement is denied, is there an appeals process? These are all detailed question and answers that are already existing on the AAICPC website.
That's a great suggestion. That makes it better. That's the actual word on this, so that will be the final source. And I believe there's also a link there if you have additional questions you can write to that person. But I'm happy to help as well if you need me to follow up with you.
Thanks. I appreciate that. And just for listeners to know, we will be posting on the advocatesforfamiliesfirst.org website. We will post these slides. We will post the archived audio recording, and I also have now made a note to also post that direct link to AAICPC so that folks can find answers to questions. Another question that is very important, I think, for those listening, I know that we have right now about 30 folks on the line, but we also have a number of folks that will be going to this at future times, and we're certainly going to be promoting it as an advocacy agenda item for people in their states. Can you talk a little bit more in detail about what steps advocates can take in their state to help promote adoption of the NEICE system?
Sure. Nicole, do you want to take that one?
Yeah, so I think simply taking the materials from the webinar and sharing it with state affiliates is a good start. I think it opens the lines for the communication, just, you know, letting folks who are in those positions know that this exists. I think a lot of people just are not aware that it even exists. I mean, at this point, we are looking for funding to grow it and expand it nationwide, so that's not currently in place. But I think the more that states are talking about this and recognizing that this could be a potential cost saver, the more that states will be interested in and could then themselves, as state administrators, be advocates to push this forward. So just inviting the dialogue and sharing the information in whatever ways that you can. So I don't know all of the networks that you guys have, but just sharing it among your networks, which would include state affiliates, I think is a good start. Or if you have opportunities to talk with legislators as well, that's always good.
And within each state, is there something that citizen review panels specifically can do to advocate for adoption of NEICE?
I don't know the answer to that question, actually, because I'm not as familiar with what their role is in the states. I know it varies. But I think anytime you have an opportunity to, you know, in talking with leadership in the state and the child welfare system, so whether it's at the administration, the agency, or with legislators, I think that the more that they hear NEICE sounds like a really great project and it's going to really help, then they'll be more supportive when we knock on their door and say, hey, we're ready to go. You know, for example, one of our states that's not participating, but is in the leadership role of the project, said, you know, she went back and said, okay, NEICE is coming, you know, when can we sign our state up? And the state was like, oh, that sounds really great. The IT system, the IT department was like, yeah, well, that sounds wonderful. We're happy to schedule that. We're probably looking about 5 years out. And she's like, no, you know, it's not a priority yet. It's a small part of a big system. So we're going to need a lot of help.
I know that in the beginning you talked pretty specifically about the potential for saving both time in terms of placements and also for saving money. But I've also heard both of you mention the cost for getting it up and running. Do you have some ideas, some figures about what it would cost for a state to implement, and thoughts about how many years out it would be until they would recoup that investment and then start seeing savings?
Yeah, so I don't have the exact numbers. That's actually part of what the evaluators are calculating right now, and that'll be part of that May report. Right. Each of the states, we've asked that question to the states, and they say it's even hard for them to calculate because the IT budgets are in a different pot of money than the child welfare budget. So it's kind of a complex question in a way. But in terms of the savings start almost within 3 to 6 months because you're just not making copies the way that you were making before. So that's kind of a more immediate return.
Wow. Well, so that's excellent. And I've got a bunch of questions. They're coming in fast and furious, so I'm glad we have time for them all. I do have a link that I'm going to be putting up that Marcy has now sent me. Marcy, I am assuming that once the evaluation is ready, we will be able to post that as well and link it to this webinar?
Absolutely. Happy to do that.
Okay. One of the questions that I have in particular, I'm wondering, are there folks in the pilot sites who have already agreed to be mentors or to be sounding boards for states who are hoping to implement?
That is such a good question, and I'm so happy to be able to say yes. That's actually one of the recommendations. We had this partners, all the state pilots come together in February, as Nicole mentioned, and we said, okay, what can we do to help your fellow states get on board? And they said, well, we can mentor them. We can be their sort of adopt-a-state buddies. And so we've sort of set it up and are putting together the plan for how that will work operationally. But definitely, there's two different kinds of TA that are available from a state perspective, which is the technical, the IT, that actually how to program and link up everything. And then there's the program side. You know, what changes might we have to make to our process to make it fit more neatly into what NEICE is doing. So the states are definitely going to mentor.
So would they contact you, Marcy, to be connected?
Yes, anyone who's interested in wanting to hear more, they should email me at that email address you see on the screen, and I'm happy to help navigate that as we put together the plans.
Super. And one of the questions that has come up is, are you seeing that this NEICE pilot project is in conflict with other systems already in place?
That's also a good question. I think it depends on the state. So in some places, the state is just using all paper. Some states, they're using an Excel spreadsheet or an Access database. And in some places, they actually have some parts of the ICPC process in their state SACWIS system. The ultimate goal, and actually with the phase 2, what we design NEICE to do is allow the caseworkers who have the systems that are sort of farthest along with the SACWA systems to be able to do the entire NEICE, the entire ICPC case from within their child welfare system. So they wouldn't have to go to the website at all for NEICE. They'd be able to do all the screens they need to do, pull all the information, push a button from within their child welfare system, and it would go through NEICE. So yeah, I'm not conflicts that are sort of barriers, but
right. It's just a matter of grouping. Yeah.
Exactly.
Have you folks been talking about or thinking about how this might impact and help with the whole rehoming question that's been going on?
It certainly has come up. I don't think we have any concrete ideas right now, at least not officially from APHSA's standpoint or from the AAICPC, but certainly rehoming is a topic that we are looking at all the time, and trying to sort of sort through what can be done. Nicole, I know you mentioned rehoming as well. I don't know if you guys if you've thought through that more than I've been a part of.
No, not at this time. Not anything that's concrete enough to share. Yeah.
Okay. And another question that I have is, how are court systems, judges, parents, attorneys, and attorneys for children helping to inform the process? Are they a part of it?
Yes, they are. We have several attorneys and judges that are on our advisory panel. And in addition, the system is built to give people view-only access, some certain people. So, for example, a judge who is on has a case of a child who's in the NEICE system may be given access to be able to track where that case is, where that child is in the system of being in the process of being placed. So attorneys and judges and their needs are definitely being considered. We've presented at the Public Child Welfare Attorneys Conference last November in New Orleans and talked to them about what would be helpful. And one of the suggestions they had is, gosh, it'd be great if we could just have a screen where we could enter all the information and send it to our ICPC coordinator in our state to make that process go faster. And so we're going to consider, how we might make that connection in the future.
Excellent. Is there, besides trying to, find some dollars in the federal budget to support expansion, are there other kinds of federal nudges that might be needed that maybe our advocates can be working on pushing for?
I mean, I think, and I'm not a policy person full time, I guess, but I think it's really important that we know how many children are involved in ICPC cases, and right now we don't know the answer to that question. So if there's anything with reporting around ICPC data that we could maybe ask for or advocate for, recommendations about making sure that states are reporting that number, then they're going to have to find a way to do that, and NEICE will be a really nice solution for them.
Great. Another question I have here was, did the project include ICPC cases for private adoptions between states? I'm guessing this was all public adoption.
Actually, it does. It has public and private adoptions, and the time frame for private adoptions is much faster. So we've had within an hour or 2 hours in some cases between states that a case was approved.
Wow, that's super. I need to give you a little kudos. We have a message from one of our participants. I worked in social services adoptions for 5 years, and I'm so glad to hear about this. This is amazing.
Oh, that's so nice. Thank you for sharing that. Thank you.
And one of the things that I kind of want to share both with you, Marcy, but also with our advocates on the line, is that Advocates for Families First has the capacity to offer technical assistance to folks in their states. So if there is, if there are folks out there that would like to get in touch and see how they can advocate on the state level, and if there's something that Advocates for Families First can do to help with that, we're more than happy to do so as well. It may be something, Marcy, that you and I can follow up with some kind of template, advocacy template that we can post.
Mm-hmm. Oh, that'd be great.
Yeah.
I think we would love to have a list of states, ready to go and sign up with us. So if you want to encourage your state to get on our list of, as we're putting our plan together and our schedule for who's going to come.
And they should just directly email you at mroth@aphsa.org.
Absolutely. Yep. That would be great.
So I have another question here from someone. We do not have SACWIS, and we are investigating a new child welfare case management system. Mm-hmm. Can NEICE be linked to other case management systems if you do not choose, if this particular state does not choose SACWIS?
Can be. Yep. And that's through those information exchange standards that we talked about.
Wonderful. Folks, if you have more questions, we certainly have some more time we can spend. And as I said, we're going to be posting some of these links, all of this information. I want to give folks a little bit of time if there's some other questions that they have, but in the meantime, I also want to acknowledge that everybody is busy, and if we've come to the end, it's okay if we end early.
We talked
we fast. Do have another. You did, and it was just a great presentation, so much information. I do have another question here, though. Is the evaluation of NEICE looking at whether the ease of getting information across states about the families through NEICE is encouraging caseworkers to more actively pursue relatives as resources and placement options?
That's a great question, and actually we gave a presentation yesterday for the Generations United advisory panel, advisory group, and that same question came up. I need to look back and talk to the evaluators to see if they're looking at that directly. It's our hope and expectation that NEICE is going to facilitate increased placements because right now I think many child welfare workers, when they find a placement that's across the state line with a relative, they kind of almost rule it out because they know it's so difficult to get through the ICPC process. So our hope is that as we get this process easier to use, the NEICE is really simple to use, and more people are aware of it and plugged into it, that barrier will go away. Right. But specifically, I don't know if that will be in the evaluation, but I can certainly ask our evaluators.
Yeah, my sense is that it probably should,
Mm-hmm.
Which then leads me to a secondary advocacy issue, and that is that once the families are found, the process for being licensed and approved can be very onerous for relatives. And I want to encourage our advocates on the line to think about the fact that we now have model licensing standards that have been, they're on our website, on Advocates for Families First website. They were created by Generations United, the American Bar Association, and the National Association of Regulatory Administrators. And they're really a great standard for each state to hold themselves to. They eliminate quite a few of the more discriminatory licensing practices and licensing questions that are out there. So it might be nice to team up an advocacy effort that combines adopting NEICE and adopting model licensing standards. Do you folks have an FAQ that you can send us that we can post and use as talking points?
We do have an FAQ. I think it needs to be updated. It's on our website. So let me get that link to you. But I'm thinking I should probably do one that's even more kind of shorter and to the point. So let me send what we have, and then I'm going to also be thinking about one that would be maybe more helpful as talking points for advocates.
Super. Something just came in. This is a great program and should be established federally. It's sad that this program has not happened sooner. I'm a supervisor for family advocates for families in New Jersey and want to share the information with our advocates. So kudos, Marcy and Nicole. Thank you for a great presentation. This writer also asked if we'll be providing a copy of the PowerPoint. And yes, writer, it will be posted up on our website on the advocatesforfamiliesfirst.org website. And if you go under capacity building and then under webinars, all of the information will be posted up there this week or early next week at the very latest. So I think that's it. I have to say, these are the most questions that we've had generated that I can remember on a webinar. So clearly, Marcy and Nicole, you have hit some important things that people are thinking about and wanting to get active to start working on. And I am very excited about the potential here for some really great work that's going to be moving forward. Thank you to our presenters for their time and their efforts on this, and for putting together such a great PowerPoint and presentation. Thank you very much to our attendees for being on the line and for asking some important questions and for being, excited about the potential for what this can do. And I hope everybody has a great rest of their week.
Thank you so much for having us, and thanks everyone for attending. We really appreciate your support.
Great.
All right.
Thank you.
Bye-bye.
All right. Be well. Bye-bye.